healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Habiba islasen para y honra, para y gloria. Habiba islasen Gitodu tempo paz para ita dan gini langit na bendición contra peligro na fansafuham Deus protege Island contra peligro na fansafuham Deus protege Island When you wake up in the morning, hear the work bell ring, and I'm marching to the table. You see the same old thing. Ain't no fool up on the table. I'm the folk up in the valley, and you better not complain more. You get in trouble with the mountain. Let the midnight special shine a light on me. Let the midnight special shine a light on me. Oh, let the midnight special shine a light on me. Let the midnight special shine the ever-loving light on me. Your neck on me frozen. How in the world did you know? By the way she wears her apron and the clothes she wore. Umbrella on her shoulder, a piece of paper in her hand. She comes to see the governor. She wants a freer man. Oh, let the midnight special shine a light on me. Right down on
Hey,
me.
good morning, Guam. All right, 6:12. It's Friday. Biba Betness, the KUAM News takeover of Guam's favorite, I-94. Good morning, Sabrina.
Good morning.
It's still your birthday in the States.
Yeah, right? But guess whose birthday it is today?
Whose birthday is it today?
Jason Solis.
There you go. It's the big Jason Solis birthday show right here on Containing COVID. We are KUAM FM in Agutnia, Guam. 6:12 on a Friday, the 24th day of April. And as usual, we got some big information coming down, real information, real time for you right here on Containing COVID. Good morning on you. There's just so many ways to catch the show. This morning, of course, where it all started here on the radio, 93.9 FM, I-94, Guam's favorite. Good morning. We're also audio streaming at Docomo Channel 10. We're streaming live on the KUAM News app and at KUAM.com. And also at 8 a.m., we jump over to KUAM TV 11 and throw the last half of the show on there. Last but definitely not least, thank you so much for all your kind questions, comments, concerns, good mornings to our KUAM News Facebook Live audience. Good morning. And as we always do, we start the show. You ready, Bree?
Yep.
We start the show with a deep dive into the day's COVID-19 news from the KUAM News team at 6:13. Good morning, Sabrina Salas-Mantonati.
Alpha Day and good morning, everyone. According to the latest information from the Joint Information Center released at 9:35 last night, Public Health tested 37 individuals for COVID-19 on Thursday with 0 testing positive. One individual, however, was diagnosed as a probable cause, formerly termed clinically diagnosed. While probable cases have tested negative, they have image findings consistent with COVID-19, displayed typical symptoms, have epidemiological links to previously confirmed case, and are being treated as COVID-19 cases. Additionally, there is one case which was diagnosed by U.S. Naval Hospital Guam and reported earlier yesterday. To date, there are now 139 confirmed cases of COVID-19 with 5 deaths and 126 recoveries. Community testing begins via a pilot project in Estumbo Dededo tomorrow. The drive-through walk-in testing is for residents who live in Sagan Linadsan and Lower Estumbo. It is from 9 a.m. to 12 noon at the Estumbo Gym. Testing is limited and is free for residents who meet the following criteria: individuals with COVID-19 symptoms, multi-generational families in a household. This includes parents, grandparents, great-grandparents, adult children, their children with COVID-19 symptoms. Public health nurses will continue canvassing the area today to pre-screen residents and issue passes. A resident who meets the criteria for the pilot testing will be issued an individual pass to enter the drive-through or walk-in line on Saturday for testing. Residents who show up on Saturday and do not have a pass but exhibit COVID-19 symptoms or who are asymptomatic will be given an informational leaflet and have their information collected by public health nurses. They will be contacted by public health at a later time. In the meantime, if you are experiencing symptoms consistent with COVID-19, you're urged to call your healthcare provider. If you don't have a regular healthcare provider, you can call any of the community health centers or public health's medical triage hotline phone numbers. They are 480-7859, 480-6760, 480-7883, and also 687-6170. Now, we talked about this on Containing COVID on Thursday, and Public Health says that it is aware of inaccuracy of false negative results from the Abbott ID Now laboratory instrument that tests for the virus for COVID-19. Public Health's lab, however, has not conducted any of its specimens in the viral transport 3 ml dilution that would lead to a false negative. According to the Joint Information Center, the lab was updated on April 14th by the Abbott point of contact technical consultant trainer that there are some false negatives due to how the specimens may be stored through the VTM collection system. Dilution of swabs immersed in liquid that may have caused false negatives. The lab ran its validation test using a lesser dose of the VTM. The Abbott technical consultant trainer acknowledged that the lab's validations went very well, but that could be due in part to the fact that they're only using 1 ml of VTM for each swab, whereas many of their customers are using 3 ml. Since April 14th, the Public Health Lab has run 51 specimens with the Abbott ID Now, with results of 50 negatives and 1 follow-up positive. For many, it sums up how they have been feeling lately, and you may have received it on WhatsApp or saw it on Facebook. Our Adriana Cotero asked the governor for her reaction.
There is a message being circulated.
And I would like to get your response and reaction to it on behalf of the community. So I'm just going to read it out loud. It's a little long, but I'll read it to you. So it says, "Dear Governor, while I live on the same island as you, I feel a world away. You asked us to help you, we did. You asked us to close our business, we did. You asked us to stay home, we did. You asked us to continue to stay at home, we are. So here I am at home waiting. You told us, don't worry, unemployment will come, it hasn't. You told us, don't worry, grants are coming, they haven't. You told us, don't worry, forgivable loans are coming, they haven't. You told us, don't worry, stimulus money is coming, it hasn't. So here I am at home waiting. I wait alongside most of my fellow small business owners, those self-employed and independent contractors, a massive number of Guamanian residents who are waiting for the unemployment portal to open for us, waiting for loan approvals, waiting for stimulus checks. All of these programs we are at the back of the line for. So here we wait while bills come daily, savings continuously dwindling or have been exhausted, and still doing our part. It is time you do yours. It is an inconceivable expectation to close unessential business, halting all income, and expect us to survive. We need to pay our bills and put food on the table. Without immediate action, you are leaving us no options. How are we to survive? We deserve an answer. You owe us answers. Coming soon is no longer acceptable." So again, I ask you, what is your response and reaction to that, to the community?
So my reaction to that is that I am being responsible. First, the reason we closed non-essential businesses and non-essential government employees is to first and foremost protect the health of our people. First and foremost, to fight the virus. first and foremost to make sure that our uncles will not be exposed and have to and have to be maybe one of the fatalities. That's what I'm trying to prevent from happening. So yes, my responsibility is to that first and foremost. Additionally, yes, the economy is also our whole responsibility. And I also wanted to say that loans, the PPE loans, are here already. Businesses have been approved to the tune of 102 million, which is about 508 businesses. Accordingly, so the Congress has recognized that it's been maxed out. So they are going to be providing more funding. So then again, that opportunity for our small business people will be there. We have given the loans out for the economic, I think it's called the Economic Injured Disaster Loan, which is the one from SBA that's about a 2 million, up to 2 million. That also has been approved and the loans have been given out to businesses. And I know this because businesses have gotten the loan. Additionally, I have not forgotten our people. Believe me, our people is the foremost of my mind, day in and day out, 24 hours a day, 365 days of the year. I am just as frustrated with the delays and with the lateness of the federal grant. And that is why I decided to use whatever I can within our local fund to advance the economic recovery program. So we actually have printed out 3,200 checks this last week and a half. There will be 3,200 more checks being printed out again for the next week and a half. Once those monies come in, we are prepared and ready to print checks for everybody. That's about the tune of $134 million. That one is going to be happening probably, like I said, first week of May or second week of May. The pandemic unemployment benefit programs, we have worked out all our processes from our end. We are just waiting for the federal government then to approve our application process, to approve our processes, and to approve the plan that we are putting in. I don't have control over the federal. What I do have control over is our local funds and our local programs. Our public assistance, like I said, has been increased 64% since the beginning of this crisis. We have put out about $100 million in public assistance. That includes the food opportunities, food accessibility. That includes cash assistance. I have increased the eligibility of our people to be able to get Medicaid by increasing the poverty level up to 133%, which means more people now can be eligible for health care. Additionally, we have continued the senior centers, the senior member arm and uncle meals every day. We have added to that. And also the Department of Education's food nutrition, we have also added to that. And now they're giving our children, our very vulnerable, precious children, 2 meals a day. And so I really understand and empathize with this writer's concern. And that's why I am working as quickly and as aggressively as I can, given what I can afford locally here, given what I can do to pressure so we can expedite the approvals that's needed. We just got the guidance for the unemployment plan. We haven't even gotten the guidance, sorry. The other guidance is for the the coronavirus stimulus package. But I want to assure the public that, I am not sitting and not doing anything for our people. I'm working very hard with what our local programs are. I'm working very hard with what whatever local monies I can. We have also are expediting our tax refunds out there. So, to say that, I'm not doing anything, I don't think it's a fair characterization of what this administration has been.
RNZ is reporting, it's an article written by Giff Johnson, that Governor Lulian Guerrero has asked the feds to enforce screening measures to slow the flow of islanders from the FAS from coming to Guam during the COVID crisis. According to RNZ, the governor sent a letter to Vice President Mike Pence on April 6th to provide guidance to the State Department, Homeland Security, and DOI to intervene on this matter of continuing travel from the FAS to Guam. She reportedly pointed out that the federal government, under the Compacts of Free Association, has the authority to institute screening measures to ensure that allowable migration is consistent with the compact. She added that she supported and encouraged this action. The article went on to further state that the governor said the two main reasons for FAS citizens migrating to Guam are education and jobs, both of which currently don't exist because of COVID-19. The governor also expressed concern that the FAS banned travel to their islands by citizens living outside, yet continued to allow migration from their countries to the U.S. under the migration provisions of the compacts. Quote, "This is very concerning to Guam." The article also states that the governor insisted the territory didn't have the resources to quarantine FAS citizens who become stranded on Guam because they are not able to return to their country, nor can we quarantine those FAS citizens who are allowed to leave their country utilizing the migration provisions of the compact. There are no confirmed cases of COVID in Palau, the FSM, or the Marshall Islands. In news from the CNMI, it is day 2 of Governor Ralph Torres' Fiscal Response Summit. During his opening remarks, he said they are for the first time trying to right the direction of the Commonwealth's finances after accumulation of obligations, expenses, and practices that have been felt unchecked since the Trust Territory government, which we came from. Governor Torres addressed these times, or added these times, are anything but ordinary, and we are dealing with challenges we in the CNMI and the world have never experienced. Again, the summit continues today through April 28th. As for an update on the USS Theodore Roosevelt, as of today, 100% of crew have been tested for COVID-19, with 840 total positive and 4,098 negative results. Of the total cases, 88 sailors have recovered and 4,234 have moved ashore. 4 sailors assigned to the Roosevelts are at Naval Hospital Guam being treated for COVID. None of the sailors hospitalized for COVID are in the intensive care unit. In national news, Congress is taking action today to help small businesses devastated by the coronavirus pandemic and social distancing restrictions. Skylar Henry has more details from Capitol Hill.
The House is expected to pass a nearly $500 billion stimulus package today.
We have to be very prayerful, and we have to be as bipartisan as we can possibly be, as united, working together.
The bill provides another $310 billion for the small business loan program that keeps workers employed after the first round of funding ran out in just 2 weeks. $60 billion is designated to help rural and minority-owned small businesses.
At a time of great crisis, Congress has continued to function and has come together in a bipartisan manner and has done important work on behalf of the American people.
But even before this latest bill is signed, the battle lines are being drawn over the next round of stimulus spending.
Democrats want to include money to support state and local governments, which have been decimated by the pandemic. But Senate Majority Leader Mitch McConnell says he's okay letting states declare bankruptcy.
It's also time to begin to think about the amount of debt that we're adding to our country and the future impact of that.
President Trump says he's not worried about the government taking on more debt.
This was an attack. This wasn't just, oh, gee. And this wasn't the flu, by the way. You know, they like to say the flu. Nobody's ever seen anything like this.
The president asked his CDC director to clarify comments that a second wave of the coronavirus this winter could be more difficult because it coincides with flu season.
I'm accurately quoted in the Washington Post as difficult.
But Dr. Robert Redfield says he disagrees with the Washington Post headline, which said the second wave could be more devastating. Skylar Henry, CBS News, Capitol Hill.
report from Coast 360 and the Bank of Guam. In anticipation of residents receiving the stimulus checks, the Guam Bankers Association members are collaborating to assist the community in check cashing in order to adhere to social distancing measures. As such, check cashing is allowed for non-customers at the following institutions: the Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. As the banks work to support the island in this time of need, the GBA would like to make the community aware of the following. ATM deposit and mobile deposit are convenient and safe banking alternatives. Those with no banking relationships may be asked to line up in a designated non-customer check cashing line and will need to provide 2 valid IDs. And that's it for your Banking 6-7 report, brought to you by Bank of Guam and Coast 360.
All right, thank you very much. That's a deep dive into our day's COVID-19 news, 6:30 on containing COVID. Let's go to the phones here and get one of my favorite number crunching doctors, Dr. Peter Lombard, onto the show. Good morning, Doc.
Good morning, Chris. How you guys doing?
We're doing pretty good. Let's just get right to it. I know that you've been crunching the numbers, and I've been following your Facebook. So, and just give us your latest take on the trends and the trajectories of the COVID-19 test results.
Yeah, well, I think if you look at these most recent pauses that we've had, at least in the past week, and the most important information to know is where are they coming from. And we don't know that. It's not being shared with us. So I don't know. From just an anxiety perspective, it'd be really nice to say, hey, these are people that have had contact with positives. They're healthcare workers, or they're a family member, and we're taking care of somebody. It would just kind of make us a little more comfortable than say, hey, this was somebody who walked off the street and they have no idea where they got it. That would be a little bit more concerning, because then public health is having to go out there and do a lot more tracing. So. But they're still, just trickling in. And, when they do this testing up in the community, if they get 0 cases, that really would help to show that we're not really spreading it out there in the community anymore. And I think it's possible, but it's probably going to be very unlikely that they're going to be able to find a whole lot of cases out there.
What do you think about the balancing the transparency in terms of what kind of information we're getting about who they're testing, and taking that and making accurate, analysis of the numbers?
Well, I try to put myself in their shoes, and I know, the governor, the state surgeon office, they've got a lot of different priorities, and it's easy to put the hand up and say, oh, let's just not give that information out. They don't have to think about it anymore. They just move on to the next thing. But it takes time and thought to think about each data point and say how important this is. I think they lose sight of what it feels like to be in our position when we don't have the information. Everything's an unknown. We're all starving for information. It's like the only thing that's going to make us feel more comfortable about what's going on. And because they have access to everything that's out there that can be known, they know it, or they can ask somebody, they can go find it for them. And I think it's easy to lose sight of what it feels like to be in a position of the public that doesn't have access to that information, and you're left to speculate and guess. So I do wish that they would spend more thoughtful time thinking about what they could release in a way that's not going to be harmful to whatever their overall efforts are. I haven't seen a whole lot of that, and in fact, the times that they put the hand up, ends up biting them in the butt a little bit later sometimes.
Have you had a chance to take a look at Public Health's website and their new dashboard?
I did the first day, and I was really excited to see it, and then I haven't gone back to it, to be quite honest. The data is kind of boring right now, I think. If the numbers are coming in at, one case here, one case there, I think that's to be expected. And again, if we knew more about those cases, you might want to pay more attention to it. Or if we start seeing a cluster show, then you might want to start paying more attention to, okay, where are these cases?
Right.
How many are there? Are we seeing a trend here where we're going to start to have another little ripple? I don't know that we're going to have a wave, but if there are ripples that come, I think if public health does their job, they should be able to suppress those.
Yeah, I agree. I think that when we're on a week now of really, really low numbers, and I'm just curious about because I think they're still on that limited, or they were still on that priority limited testing group. So when we get 30 people, no positives, I'm curious. You're right. Who are they testing? Are these people who came into contact with people who are positive, or they PUIs or what? Because I think it's very relevant. They should come out and say, hey, we tested a bunch of people who, came into contact with somebody. We tested their family or whatever, and that was. But you're right. I mean, and I think what you said about them forgetting what it's like to be us. I mean, you could take that and apply it to the COVID-19 test result numbers. You could take that and apply it to people who are struggling out here, waiting for any type of local aid to bridge them. I mean, you could kind of apply it across the board, which isn't a good statement.
Yeah, we're grasping for any piece of information that might be useful to us. And we don't have a whole lot more to do besides pay attention to what's going on out there. And then the perception is that they're not being as fully transparent or giving us as much information. And that's a perception, and they can't dictate the perception. I mean, the perception is what we feel, and that's what people feel. Perception is reality. So I do wish they would spend more time on that thoughtfully.
Well, what would you like to know, Doc? What would you like to know?
Simple thing. Just it's something I ask about almost every day is, well, just give us a little information about each of the new positive cases that come out, if you can. And if you can't, then just say you can't, and maybe why you can't, and with privacy reasons or HIPAA or ongoing tracing, it would jeopardize something. I think we would all understand that more than just throw a number out there and then not say anything, or if there's some strange issue with the number of test results, to qualify that with why. Is it the reagent? Is it the swabs? Is it they just didn't have that many tests? I mean, I think it would just make us more comfortable with that. Now that we're past the peak, the first surge, everybody's a little less concerned, and I think there's less that I want to know. Before it was like clusters. Where are they? Why aren't you telling us which clinics are involved? This and that. So at this point, I'm not as and again, because we've been successful. I mean, don't take away the fact that we've been successful here in Guam. Because we've been successful, it's sort of hard to sit back and criticize what they've done to this point. And one of the biggest things that I think that we need to recognize is that they acted quickly enough to bring us to this point. I've talked about on my post maybe not giving ourselves too much credit for being successful compared to other places, because we are an island, and I do think our sense of community here is probably better than a lot of other places, and maybe people were more compliant with the stay-at-home orders than other places, and because the stay-at-home orders, the closing the schools, the face mask, that same sort of policies are in play everywhere. But we seem to have done a lot better. Is it simply because of our community nature and the fact that we're an island and can close the borders? And I think if you look at other island nations, you kind of see they're not doing so bad. So maybe it wasn't any heroics on our part in general, other than making sure we start right away rather than letting it get out of hand. That was definitely a big win. But it's something to consider.
I think also. Go ahead.
Oh no, I just wanted to say there was something you posted on your Facebook page. This topic should garner more media attention in the coming days. Even if you account for COVID-related deaths, more people are dying than normal. Is this unintended fallout of the lockdown? People so scared to see their doctors, they are dying from the usual suspects.
Yeah, we don't know. This is really interesting. I posted a link to a study in I think Santa Clara, but there's another study that came out in New York City. Same thing, New York City, where they're having tons of people die, and they look at the total number of deaths and they subtract out the number that have died of COVID, and there's still more people dying of non-COVID related stuff than in a normal year for over the same time period. So there's something going on where the fact that there's COVID in the world is causing more people to die for whatever reason. And so it is very interesting, and I don't know what it's going to mean exactly, and it may have nothing to do with the fact that people are not getting their health care, but maybe that has something to do with it. And if we went about our business more normal, and people did get their regular, they went to their PCP, they got their refills, they got their blood tests, is that having an effect on this sort of missing number of deaths out there? I don't know, total speculation, but it's interesting, and I think people will start talking about it more.
Well, I think that, and that's part of why we're seeing, some of the doctors like Dr. Hoa, Dr. Cabrera, they're talking about COVID, but there's also this side conversation about hey, people with these chronic diseases, you've been, sheltering for, over a month.
Yeah.
Make sure you refill your meds. Make sure you call your doctor. Make sure you check in because they're worried that we could see a wave of hospitalizations that has nothing to do with COVID-19.
Yeah, exactly. And in my field, I've got diabetics that need, injections or lasers, and if they're home because they're afraid to come into the clinic, and they could potentially lose vision because they don't get their routine care. So I'm definitely seeing it on my side too. We're trying to get their urgent patients into their regular appointments, but some of them are just declining, and I got to understand that too. They're afraid.
Well, what do you make of the community testing? Again, you think this is something that I know you said you're not anticipating us getting a lot of positives. So why are you saying that?
Well, I think it's if we do, it's going to be very, very curious. I think that there are people out there that get the disease that are long incubators. It could be 2 weeks before they, before they seroconvert, before they would even be infective. So if you get 2 people in a row that are long incubators and they're asymptomatic, that's a month's time where they could have transmitted within a family. Okay, even one more person further, you've got some big families out there in households. That's 4 to 6 weeks of transmission, and so those people might be out there, and at some point, one person may start infecting people who do get sick, and that can be the start of a cluster. So if they do find somebody like that, it'll be very interesting to try to trace to see where that came from. I think it's certainly possible. I think if you've been following, I just threw out sort of a rough estimate of about 4,000 people in Guam who might have the disease in total, and most of those obviously being asymptomatic or people with low symptoms, and that's based on some early prevalence data that's coming out. New York, by the way, they're estimating maybe 14 to 15% of New York City might have it because they're one of the hardest hit cities. But if you take about somewhere between 2 and 3% for Guam, we're talking 4,000 people. So if 4,000 people have been affected to this point, right? Most of them are probably already also recovered or recovering by this point. If we've done a good job with social isolation, you're starving the virus out, right? The idea that we're going to be able to go out into the community and find some people now, I think it's not very likely, but it could happen. If we are continuing to have community spread from asymptomatic to asymptomatic person, at some point, somebody's going to have to come to the hospital because we know that some people are just going to get sick enough. And if we're not seeing those admissions to the hospital with people with COVID, then I just don't think that there's a whole lot of community spread going on among asymptomatic people.
What are your thoughts? There's people who've said that, COVID has been on Guam a lot longer than March, that it's actually been around since, say, November of last year.
January.
Yeah. Yeah, well, it may be January. I think there was the coroner report from California showed that they had a death that much earlier than they had their first documented case out there. So it's possible, and I think probably likely that we had it here, certainly in February. And anecdotally, there's people who say in the hospital they had some really sick patients, and they think back and they thought that person probably had COVID. So I think it's very likely that we had some. Now, December would be a bit more of a stretch. There was a big article about, California's got herd immunity because the virus was in their community in the fall and the winter last year. That's sort of been debunked by good science. They look at the when they collect these samples, they also submit them for genetic analysis, and so you can actually look at the genetic analysis and see how the virus mutates over time. And by doing that, you can track where it came from. And because of the types of strains that they saw in the California data, they know it came from locations that had the virus before them. Okay, so when you look at and see the mutations that are happening on a virus, it kind of is a nice timeline. Gives you a timeline of when and where the virus was. And a fantastic website, if you want to go take a look at this, is nextstrain.gov.
What about that, applying that kind of same thing, that same idea to Guam, where, we've been trying to ask about these deaths that were classified as PUIs. We know that some bodies have been tested. They turned out negative. But what about that conversation? Do you think we're ever going to get to that point where we're going to exhume bodies, we're going to go back and look at, have we had any other deaths? Or do you think that maybe the political will to do that probably isn't here if we're trying to reopen the island?
Probably not. And to be honest, I don't think it's going to make a big difference. You know, it's a nice talking point and something that I think it's a good thing to talk about. And I think most people would probably say, yeah, we probably did have some. You know, I think it'd be silly to think otherwise.
Right.
Especially in light of the recent finding in California. But I don't think we're going to gain a whole lot from that. Oh, yep, it's true, we did. You know, and okay, now what? So I think, you know, from my perspective, it's kind of assumed that we did have a few. Don't know how widespread it was, but again, if it was more widespread, I think it would have been more of an issue in the community.
Okay. All right. Well, thank you so much, Dr. Lombard, for all of your input today. Any final comments?
Well, thank you guys. I don't know how you do this every day. It's kind of an emotional topic, and you guys really get into it. So I really want to thank you for. I don't know how you wake up every morning and have the courage to go out there and do what you do. So
well, there's a lot more people who got a lot more courage than us. But you know, it's funny that I'm going back to what you talk about. People kind of locked in, and you know, maybe dealing with things they don't really know they're dealing with. Like, I mean, we're stressed, but I didn't even know I was stressed till I started running again last week. And you know, after I did that run, I was like, wow, I needed that. Holy whoa.
Yeah.
So I mean, I think there's a lot of stress that's on us that maybe we don't know because, you know, people are just plodding through these days, and there's just all these outside factors of, you know, I mean, are we going to get COVID? How are people going to eat? Anyway.
Yeah.
It's a little early to go on about that.
I know.
As I got 3 more hours. Thank you, Doc.
Thank you.
Thanks for having me.
Be safe. Wash your hands.
Bye-bye.
Okay. 6:45. Let's keep it with the doctors and go over to Dr. Tom Shea. Good morning, Dr. Shea.
Morning, Chris.
Half a day.
So first, you know, we're gonna get Catherine from the chamber on, but I just wanted to first kind of start with you and this. There's a message going around on WhatsApp. We've been able to confirm that it is part of a plan that the chamber was planning to give over to the governor's office about reopening. Can we just kind of get your thoughts on that first?
Well, I just read what I think KUN reported it,
Yeah.
but I don't know what the full detail is. But you know, if chamber, if they want to work with the Guam Medical Association, would be more than happy to take a look at their plan.
Yeah, let me just go back and let me read this out for you people who are just joining us. This is we've confirmed that this is a plan from the Chamber of Commerce, and their idea to give over to the governor about reopening the island in phases. And you probably got it on your WhatsApp. Going into the next week, the Chamber's plan calls for other service and retail businesses to open using social distancing and sanitation protocols. Appointments would be needed for barbers, salons, gyms, realtors, shopping centers. Additionally, malls and shopping centers would have to limit the number of people, a concept that retailers such as Home Depot and Payless have adopted. The week of May 4th is when the first big phase would start, assuming the rate of infections remains low. Currently, it's about 13 to 14%, according to the governor. Phase 1, allow all private sector businesses and government offices to open while abiding by social distancing and sanitation protocols. Bars and restaurants remain closed for sit-down service. Phase 2, the week of May 25th, allow for all parks, restaurants, and other places for gathering to open while adhering to sanitation and social distancing protocols. Phase 3, the week of June 22, all public places and private businesses would resume normal operations with the same sanitation protocols and limited social distancing. All bars and restaurants will be allowed to open, and larger gathering which adhere to CDC guidelines would be permitted. The government should also prepare to start body temperature scanning, pre-boarding health surveys, and foot pass sterilization pads for incoming arrivals at the A.B. Wampat International Airport. So your thoughts, Dr. Shea?
Okay, well, let's start with the last one.
Yeah.
Let's work the bottom up. The last one, where they plan to open the airports, I suppose they're going to get ready for tourists. Well, that's got to go away. First of all, I think the testing should be done also. If they want to test pre-boarding, I think that's good. That's okay. Screen them pre-board from the destination to Guam. But upon arrival, I think we still need to really watch the quarantine aspect of it and visit the areas where they're coming in from if there's any active infections. I think they should test them there. I think the chamber has the right path. I think we're going to have to reopen someday somehow. And I think we'll work with the chamber if they want to get our doctors involved. But the community doctors, I'm not talking about government doctors or those people who's on the advisory board, because I think they may not be seeing eye to eye. But I think the community doctors, we like to see the community also start learning to live a life that's not the same anymore. And I think the chamber has put in some thoughts there in different phases, but the phases are coming from the Trump administration, phase 1, phase 2, phase 3.
Right, yeah.
There is no line in the sand. Okay, there is no phase 1, phase 2, phase 3. This is a process where you're going to say that you're going to have to intermingle every single phase here, because you go from phase 1, phase 2, you're going to go back to phase 1, and from phase 3, you're going to go back to phase 1. I don't like to use phases. What I like to do is try to integrate some form of normalcy that's not going to be back to what we used to live our life as, okay? We're going to have to learn how to live a life with social distancing for a while, and how to clean our hands properly. Sanitizer is not around everybody's hands, so we're going to have to, the business is going to have to somehow provide those for customers, and especially for their employees.
Right.
Because ultimately, if they want to open their businesses, okay, the responsibility to protect the employer and the employees is upon the employer, the person who's opening that business. If I were to go into a restaurant, if I were to go pick up something and I get sick, and it's because of contamination from a place that I went to, the responsibility falls on the owner of that establishment. So they need to be very careful with that. But certainly, I think, I think the chamber is on the right path. I think we're going to have to reopen somehow, some way. And I think the normalcy in the past is going to have to be put aside. And how do we live normally for this coming summer? And I think the governor's aspect of it about opening, or I don't know what her plan is, basically, but going back to their canvassing, I need to comment on that.
Yeah. And you're talking about the canvassing that's going on right now in Stumbo.
Yeah.
Mm-hmm.
Yeah, that's kind of, I don't want to say stupid, because I don't think it's stupid, but I think it's kind of taking one step back and say, hey, if you're going to go out canvassing, you already know that person who is symptomatic, who's living at home, that needs to be swabbed or tested. Why give them a coupon to come out and to be tested? You know where they live. And you already have nurses who go in there, swab them at your house. Don't tell them, hey, come on out, or let me come out to public and let me test you then, give you a coupon. I mean, that's so stupid. Oh, there I said it, sorry. But, the point is this, okay? They're already doing the canvassing. They're already doing the work. They already identify which houses, where they are. Don't give them a coupon and say, hey, come on out. You think they're just going to come out and just go test and go straight home? What makes you think they're not going to stop at Payless or stop at Home Depot or any of the other establishments to pick up something for themselves? And who's going to drive them out? That's the other thing, too.
I mean, you make a good point, Doug. You're basically saying, hey, we're already going into these houses. We're talking to these people. Why not just swab them there? Instead of doubling back and doubling in.
Yes. Use some common sense, for God's sakes. You already know where they're going. I mean, where they are. Leave them there. Don't tell them to come back out, especially if they're under the weather. You know what I'm saying? And if you know they're very, very sick, why are you still living in? If you think they're going to be admitted, then take them out. Call the ambulance and take them out right there. And quarantine the entire household. Don't wait. Giving out coupons to have them coming out where you know exactly where they are, that doesn't make sense to me.
Another thing.
That was the first time actually I heard about it, and when I read that release, I was like, I didn't know they were giving passes.
Yeah, so we were kind of told, hey, everybody come out, everybody get tested, and then that's what we've been saying, because that's what we were told to say by the government, and now, not told, like they said, hey, say this, but that was what they said. We're going to test everybody. We want to test. I mean, are we just going to let it slide that the governor had come out in a press conference earlier this week? I think it might have been that we're going to test 258 people a day, and it's already Friday, and we're still testing 37 people. So.
Yeah, well, I already put it out there that I think the 3 places you should be testing, and that's very, very important. The airport, you got to test the people who's arriving, test the workers at the airport, test GRMC, the healthcare workers, because the healthcare workers intermingle with the community and also over at GMH. And at GMH need to also be tested as well. Those 3 facilities, airport, hospital, GRMC, and GMH. Those are the targeted areas I think they should focus on first as a priority. And then if they want to go out canvassing, canvass, but you identify the people who's already there, but don't give them a coupon to come out and get tested. Test them already. Stay home.
Well, good idea. And I think, maybe they just don't have that outside set of eyes to say, hey, why don't we just do this way?
I think they do. I just don't know. I think they're just winging it, in my opinion. Like, okay, what should we do? What should we do? Okay, let's try this. Let's do this. I guess I'm getting so frustrated.
Let's test everybody. Okay, no, let's not test everybody. Let's just only test people with symptoms.
But, if you want to call everybody out to one place, that's fine. But when you start going out canvassing, that's another good idea. But it's a bad idea to say, hey, you know what? You're kind of sick. Here's a coupon. Come on out. And then let me test you at this center. My goodness, stay home. If you're sick, we'll come to you and we'll test you there. And I hope they're listening to your show and hopefully take my advice.
Well, it's
But
kind of
if
late in the
they
game.
alone, you know.
Right now they're like,
Well,
damn
come
it,
on.
who didn't think of that? What?
Well, I don't know. I don't know. But the chamber, I think the chamber, first, I think the GVB and GHRA has learned their lesson as far as advertising goes. And I hope they don't go out advertising and say, hey, we only have 2 cases of corona free, or 2 cases of corona here, and come out to Guam. I think they learned their lesson. I think we cannot have tourism coming in. I think residents of Guam, they got to return here. I can understand that. But I think rather than strict quarantining them upon arrival, I think test them first and see what's going on.
Right.
Test them again in 5-6 days and follow them and see what's happening. Not just screening from the destination to Guam. I think you got to test them upon arrival. And I think the hotels, the plans for the hotels, believe me, I'm one of the biggest supporters of Guam hotels and restaurants. Okay, I eat out every day, but now I'm eating at home alone. I'm cooking, and I think I'm coming on my own set of menu. I think.
Yeah.
But
Not bad. Looks pretty good, Doc.
yeah, I'll cook for you one day. We'll do it.
One day from
But,
6 feet away.
Yeah, but I think the hotels. I think to reopen hotels, I think we've contained this virus enough within the community. The second wave, if anything, well, God forbid that the second wave is going to come man-made, that they're calling people out after this canvassing, but it's going to be coming from the airport. The airport's going to be that second wave that's coming through, in my opinion. And it's no-brainer to say, hey, the September and October we're going to have a surge. Think about it. That's the flu season. You don't need a model to tell us that. Okay? That's common sense again. So, again, the Guam hotels, I think what they need to do is start thinking about how to get back into business by taking care of the locals, okay? And the chamber says all restaurants, eateries, eating inside is going to be out of question. I don't think so. I think there's a way around that. I think you can still open a restaurant, but with a caveat that if you have a capacity of 100, perhaps you can't open for 100 people. You can take reservations and you split them apart and then go ahead and set it up so that the capacity from 100 maybe down to 20 or maybe even 10. Start with 10 and then go from there. And then we're going to have to live a life that's totally different.
Yeah, I know. I'm already thinking, Doc, I'm just going to keep rocking this mask after all this. You know what I mean? And you're right.
Listen, the mask's going to have to be on.
Right.
The social distance is going to have to carry through the entire summer, maybe through the fall. But maybe the mask is going to have to be on no matter what. But, I think what I'm trying to say is that the hotel restaurant says the restaurant's closed. But I don't know. I think they can work around it and learn how to live a life that's going to be around this virus. But the key here is airport. The second wave is going to come in from airport. You got to protect that airport. It's very important. And I said that back in February. I told him the airport, that's the gate. You got to watch that. But, just send the advertisement out into Korea, I guess. But I don't know.
Has the Guam Medical Association come together, whether it's a Zoom conference, and maybe have their own set of recommendations?
We try to get into the physicians advisory group, and even this morning I said, hey, listen, you're going to meet up with Homeland Security or FEMA. Why don't we have all our doctors Zoom in? We can have a Zoom. We're participating with Zoom conferencing over 300 people. Why can't we just Zoom in and have all of us listen in what's going on? They refused. They said, oh, no, just sit at the question.
They only want the nice doctors, Dr. Todd. They only want the nice doctors. You don't want to be on that physician's advisory group anyway, because you gotta watch what you say. If you say the wrong thing, they get in trouble. They're gonna make you stand in the corner. The governor's gonna get mad at you.
Especially Dr. Tom Shea. We definitely don't want him in the room.
You're gonna spend the whole day in the corner.
No, but nothing's stopping the GMA from coming up with their own, like the chamber, their own, because a lot of the chamber aren't on the economic, recovery panel.
Of course, but I think, but we'll work with the chamber. If the chamber comes to us, we'll work with them. And I think they're going to have to work with the doctors, and then they have to choose who they want to work with. Certainly, if they want to choose to work with the advisory board, go ahead. That's okay. But, as far as we are concerned, I think I'm concerned is that we want to continue to protect the island. And I'm just telling you, from a common sense standpoint, I don't look at models. I don't look at projections. They don't apply to Guam. We're flat. Guam is a flat island with 160 population, and they're comparing it to New York City, to Singapore, to Korea. Those are millions of people. I mean, I think we've contained this virus enough here locally, and I've been watching the hospital curve. I go to the hospital every day. I walk that hallways every day. And you don't think I'm scared? Of course I am. But I feel comfortable to say that I think we contained this virus locally, The social distancing is great. I think we've done that. And you know what? Now they're saying, hey, don't stay home and come on out and get tested. Are we going to start changing our PSAs? I know KUM was involved with our PSAs and running some ads. I hope we don't have to go back out and say, hey,
we do.
Stay home now.
Now the message is go get tested, get tested, get tested.
Oh, you're sick, come on out. You know,
Yeah.
go see your doctor.
Right,
Don't do that. If
Right.
you have a cold, common cold or anything like that, just stay home, call your doctor, do a telemedicine conference with your doctor, continue to do that, continue to stay home. We're starving this virus. You know, I think there's a Chinese saying also is that, you know, what's evil? Don't go looking for evil. Leave it be. Let this virus die. Don't go waking up this virus. The virus is already dying. Don't go knocking on the doors and waking them up.
So you don't agree with this next phase of testing where you cast this wider net to determine the prevalence of COVID on Guam?
Well, not necessarily. I don't agree. I think testing is okay. They can test, but test the airport, the hospital.
Okay.
You know, those are the critical areas that you have to protect.
Right.
You know, going out canvassing. Okay, let's say you test this area in Stumbo. Okay, that's only one single area that you're testing. I know there's all this a pilot project, but canvassing, good. Then go to the doors and test them there. Don't give them a coupon and come back out. If you're sick, stay home. We'll come to you. You know, those are common sense things, the strategies you have to apply.
Yeah,
Because you're sending people
man,
out
Doc, you know, and even the messaging of the last couple of days, you know, we spoke with, and obviously, you know, one of the groups that I think they're trying to target, at least ethnically, is, you know, people from the FSM and multi-generational families. So we had got Johnny from the FSM consulate office, and he had told us, he said, man, I wish they would have reached out to us and we could have done like a whole outreach into the community and, you know, done some translation and put out some flyers.
Sure, there you go.
So
You know, work with the communities.
Right.
If you're going to target FSM, if you're going to start talking about nationalities and stuff, they work with those people who's in charge of those groups. And, you know, don't tell them to come out. We'll come to you. And then we'll set it up in a group, you know, just like Bone Marrow Drive. We'll come to you, we'll set it up.
But you
There's
see
no difference
what's
there.
what's changed in the last couple of days is when they first announced this, they were like, we want to test a lot of people. We want to test everyone. Come out. And now it's like, oh, no, we're going to give you a coupon. You got to do this. So already, I mean, people are being told by the administration that they want to cast a wider net. They want to test everybody. And then, you know, it's almost like the criteria is still narrow. So.
Yeah. Well, you know, the thing is, if they start canvassing, they already know, hey, we got the manpower to go canvassing. If you got the manpower to go canvassing, then you got the manpower to go and test them at their door.
You're right. I mean, if they're going to go into someone's house and be like, hey, do you feel sick? Hey, do you this? Come here Saturday. They might as well be like, hey, do you feel sick? Okay, you want to get swabbed right here? All right, you're cool. Okay, let's do it.
Yeah, and I think they said that without the coupon, you won't get tested, right?
Yeah, that's what it kind of sounds like. Well, we're gonna get Linda on the phone here in about 15 minutes, so we'll ask her. Thank you, Dr. Shea. Right.
Yeah, give my suggestion to Linda, would you? I mean, I'm trying to be constructive.
Hey, I want to be good with Linda.
Oh yeah, of course.
Send her the link.
Yeah.
I know Linda since the day I arrived on Guam.
Right.
Okay. I was working at public health, at Southern Public Health. I've seen all the pregnant moms down at Southern Public Health, and you can ask Linda that. She was the first person I met at public health, and she asked me to come on down to Southern side. And I did that for, I think, 2 or 3 years straight while I was in the Navy. So I know the public health system pretty well. And she's done a good job with the public health system. And I applaud her for it. She's in a difficult position. But allow us to give input and help her out. That's what I say.
Right on. Okay, Doc, thank you.
Take care.
Wash your hands.
Bye.
Dr. Tom Shea, 702. Good morning. We got to take a break, Bree.
Okay.
Okay, because I know it's about bathroom o'clock. It's 702. We're KUAM FM Agani Guam. It's the KUAM News Takeover of Guam's favorite, Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and
proposal from the Chamber of Commerce to reopen the island in phases. And remember, today the Governor's Economic Recovery Panel is supposed to present their plan to reopen the island to her recovery panel of advisors.
And a heads up, that press conference, it's usually around 1:30 to 2.
Right.
Today, it's supposed to be at 11:30.
Right.
So we'll be streaming that at 11:30, broadcasting it on TV8 at 11:30.
I just got to go to these press conferences because, we've been bringing them to you guys, but one thing that I really noticed in the comments is a lot of people have a big problem with the way the governor strolls in so late to these press conferences. And at first I kind of thought, well, she's probably, and obviously, right, you would think, oh, she's probably busy or something, but it's like every single time press conferences at 1 p.m., they come strolling in at 1:40, 1:45, and you can see it in the comments. People are just offended by it because they're all tuning in, and that, talk about a captive audience. People are tuning in because no matter what they think about the governor or what, they want to hear what she has to say. They want to know the information, and it's frustrating. It's frustrating when, and just going through the comments, you could do it, hopefully they'll be on time today, but if any of the press conferences, you just go back through the comments and people are just pissed off about it. Yeah. They're like, where's the governor? Why is she making us wait? This is ridiculous. Every day it's the same thing. It's always late. It's always late. And there's just never any acknowledgement of it, which I think is just, how hard is it to go on and say, oh my God, sorry I'm late, guys. I was, in this big meeting trying to get you guys some local aid or whatever. And I feel like they probably just think, and knowing how these guys in the administration kind of think, and it is what it is. They probably think, oh, what's the big deal? We're busy. Mm-hmm. But still, it's just it's about the consideration, but more importantly, it's about just respect for the people who have showed up to watch you speak and deserve a little more consideration, a little more respect. So. We had played the governor's clip from the press conference yesterday about
the WhatsApp.
Yeah.
Mm-hmm. Are you gonna play that again?
Yeah, you want to? Let's go play this again, and then we're gonna go ahead and read off some of your comments in real time. This is from the press conference yesterday, and I know you guys had seen that viral WhatsApp message that was going around about asking. Right.
Yeah, people stayed home. They've done exactly what you told us to do.
Right. So let's play this. Ken, you ready over there? This is Adriana Quintero from the KUAM news team at yesterday's press conference.
There is a message being circulated, and I would like to get your response and reaction to it on behalf of the community. So I'm just going to read it out loud. It's a little long, but I'll read it to you. So it says, Dear Governor, while I live on the same island as you, I feel a world away. You asked us to help you. We did. You asked us to close our business. We did. You asked us to stay home. We did. You asked us to continue to stay at home. We are. So here I am at home waiting. You told us, don't worry, unemployment will come. It hasn't. You told us, don't worry, grants are coming. They haven't. You told us, don't worry, forgivable loans are coming. They haven't. You told us, don't worry, stimulus money is coming. It hasn't. So here I am at home waiting. I wait alongside most of my fellow small business owners, those self-employed and independent contractors, a massive number of Guamanian residents who are waiting for the unemployment portal to open for us, waiting for loan approvals, waiting for stimulus checks. All of these programs we are at the back of the line for. So here we wait while bills come daily, savings continuously dwindling or have been exhausted, and still doing our part. It is time you do yours. It is an inconceivable expectation to close unessential business, halting all income, and expect us to survive. We need to pay our bills and put food on the table. Without immediate action, you are leaving us no options. How are we to survive? We deserve an answer. You owe us answers. Coming soon is no longer acceptable. So again, I ask you, what is your response and reaction to that, to the community?
So my reaction to that is that I am being responsible. First, the reason we closed non-essential businesses and non-essential government employees is to first and foremost protect the health of our people. First and foremost, to fight the virus. First and foremost, to make sure that our uncles will not be exposed and have to and have to be maybe one of the fatalities. That's what I'm trying to prevent from happening. So yes, my responsibility is to that first and foremost. Additionally, yes, the economy is also our whole responsibility. And I also wanted to say that loans, the PPE loans, are here already. Businesses have been approved to the tune of 102 million, which is about 508 businesses. Accordingly, so the Congress and the Congress has recognized that it's been maxed out. So they are going to be providing more funding. So then again, that opportunity for our small business people will be there. We have given the loans out for the economic, I think it's called the Economic Injured Disaster Loan, which is the one from SBA that's about a 2 million, up to 2 million. That also has been approved in the loans that they've given out to businesses. And I know this because businesses have gotten the loan. Additionally, I have not forgotten our people. Believe me, our people is the foremost of my mind, day in and day out, 24 hours a day, 365 days of the year.
Yeah.
Yeah, can you read some of the comments
Sure.
real
Okay,
quick?
so here's some of the responses you guys had to. We just cut off the rest of it. She
Right,
said a
yeah.
whole lot
We're going
more.
to play it again at 8 for you guys.
Yeah. We don't believe you anymore. That's what Jim Carter wrote. Mary Noel, she just says Hafide. Linda Havlinar, good morning. Keep up the good work, Governor. Tony Paul, she's done her best. Harvey Egna, Gov, if you are really concerned, release the 2019 tax returns. Otherwise, your comments lack credibility. If you really wanted to help, you could.
Maxella writes, today is the 24th day the governor is expecting the remaining balance of the federal assistance. So please call the governor to have her say in regards to helping the community. Have the community call in to question her. I'm hoping she has good things to say today.
Leanne Beneventi, we need to set up food distribution centers now. If you are a leader, then lead. Don't hide behind excuses.
Someone had also wrote in that they would like to see the governor get emotional. And there was a response to that. I don't know about getting emotional. I'm pretty sure if she does, people will be attacking her about that too. She's weak. She's unstable. She can't catch a break.
Jim Carter, she doesn't know what it feels like to be broke. So I say that she's not at heart about all of this. She is full of it. But okay, we will wait for it. That is all we can do.
All right. And so, what did you make of that, Sabrina? Because the governor, did she get emotional there when she talked about you were on her mind 24 hours a day, 365 days a year?
Well, I think she was defensive.
It was more defensive,
yeah,
right?
Yeah. I think because she started off her
the
press conference kind of like on that same tone, saying the same thing.
Right.
On how we have all this aid that's coming in.
Right.
And we're working on it, and we're trying really hard to get it to the people of Guam that need it. But you can apply for food stamps, which is also federally funded, by the way.
Yeah. And did she just try and take credit for those SBA loans? Because that's what it sounded like.
I don't know.
And I mean, to me, it's just so easy. It's just so easy to.
For me, I just feel bad for people.
That's the thing,
that
I feel bad because they're bringing all their troubles to the governor, and the governor's response is, "Hey, I'm waiting on the feds, and I'm go apply for food stamps, and they got the SBA loans, and you guys."
Maybe there is just nothing.
I don't know. That's the point. I mean, if there is money to do it, is there? We don't know. No one's coming out and saying anything. The senators don't want to say anything because they're going to get in trouble. Mm-hmm. So I guess that's the question: is do we have money? We got $59 million from the feds. So are we able to use that as some kind? I mean, I don't know. And I think if it's that we don't have the money, then she needs to just come out and say it, and just give it to us real, but just don't keep saying hang in there, go apply for food stamps. Hey, we had a 60-some% increase in people applying for assistance because, again, if you pay,
maybe we should just ask how much is in the bank. How much money do we have?
Right, and can we use it to do advance payments? Because and I think it's if you're in touch with what's going on out here, people were expecting the federal aid by now because you told them that we'd be getting it by now.
Right.
So
and they're already working on another package, federal package.
Right, and so that's what people are saying is that we thought we would have our stimulus checks by now. We don't. So how are you going to help us? You asked us to hang in there. Again, we did hang in there. Now there's just nothing left to hang on to.
Mm-hmm. We got a comment right here from Andrew Terlahi. I'm just glad that I'm not in her position. Hard times call for hard decisions.
Right. 718. And there was another story, too, that we were going to kind of touch on, and this was almost Trumpian, and I kind of wondered why we didn't hear about this from the governor's office. And this is a story out of New Zealand, Bree.
RNZ?
Right,
Yeah,
the Republic of New Zealand. And so Guam wants the U.S. to cut the flow of inbound islanders from the Federated States of Micronesia because of COVID-19.
Yeah, and I guess this was a letter that she wrote on April 6th, I want to say. But yeah, she asked that the feds enforce screening measures to slow the flow of islanders from the FAS from coming to Guam during the COVID crisis. According to RNZ, the governor sent a letter to Vice President Mike Pence, again on April 6th, to provide guidance to the State Department, Homeland Security, and the Department of the Interior to intervene on this matter of continuing travel from the FAS to Guam. She reportedly pointed out that the federal government, under the Compacts of Free Association, has the authority to institute screening measures to ensure that allowable migration is consistent with the compact. She added that she supported and encouraged this action. The article went on to further state that the governor said the two main reasons for FAS citizens migrating to Guam are education and jobs, both of which currently don't exist because of COVID-19. The governor also expressed concern that the FAS banned travel to their islands by citizens living outside, yet continued to allow migration from their countries to the U.S. under the migration provisions. Quote, "This is very concerning to Guam." The article also stating that the governor insisted the territory didn't have the resources to quarantine FAS citizens who become stranded on Guam because they are not able to return to their country, nor can we quarantine those FAS citizens who are allowed to leave their country utilizing the migration provisions of the compact. And there are no confirmed cases of COVID in Palau or the FSM or the Marshall Islands.
Right, and so I guess, if we get a chance to follow up on this, my main question would be, why didn't the governor's office tell anybody about this?
Mm-hmm.
You know what I mean? 7:21, we're going to switch gears. We got Tom from the Salvation Army coming up to talk about the great increase and the great need the people of Guam are in right now. But 7:21, just want to get her on ahead of the community testing that's going on in Estumbo tomorrow from the Department of Public Health and Social Services, Linda Ampinko Denorsi. Good morning, Linda.
Good morning.
So we had heard, and maybe you can just kind of verify, you said it, so they're out there canvassing, and now people with the COVID-19 symptoms are meeting any of the criteria for testing, or they're going to get a coupon.
Or a pass.
A pass.
A pass.
Yeah, okay.
Yeah, a pass.
So I guess just take us back to when your staff is out there canvassing, maybe the process from, knock on the door to getting the pass.
Absolutely. We have in our Department of Public Health two units. One is the surveillance unit that's comprised of all our nurses, and the other unit is our containment unit. And those are the individuals that are heavily involved. They're CDC workers to contain the spread of the infection. And so what they're doing is they're teaming up along with our mayor on all the different homes throughout the area that we're targeting, specifically the Sagan Linahasan and the Lower Estumbo Indedido residents. And so they would go out and they have their assessment form. And again, that assessment form has a series of questions of the different types of symptoms that the patient may have. For example, do they have a fever, or do they have any chills, or do they have any muscle aches, runny nose, sore throat, cough, shortness of breath, any diarrhea, vomiting, and so forth. Also, we are looking at another unique symptom, which is the sense of taste or smell being lost, or even appetite, and some discoloration on their fingers or toes. While they're doing that assessment, we're also looking at other pre-existing medical conditions, such as chronic lung disease, emphysema, asthma, or COPD. That's, of course, the pulmonary diseases. Diabetes, of course, as you know, cardiovascular, and lung disease, liver disease, end-stage renal disease, hepatitis, and if they're smokers or they were current smokers. In line with that, we also are assessing homes that have multi-generation. In other words, they have grandma, grandpa living in the homes all together. But our main focus here, Sabrina and Chris, is really the symptoms, because we're looking at another approach, which is elimination. Okay, we want to expand testing criteria, as I mentioned, to all these other clinics, right, that have been doing all the screening and the testing. In the past, we focused our energy on testing those patients that are hospitalized with COVID with COVID symptoms. We also focus our energy on people with chronic conditions that have symptoms of COVID-19, and also healthcare workers that may have COVID-19 symptoms. But now, and we told them in the past, okay, let's have you, if you have mild cases, just stay home. Now we want to move forward in our posture of eliminating this virus, and the only way we're going to do it is to expand our testing criteria for the mild cases of those that weren't able to be hospitalized, or they didn't meet that criteria to be hospitalized or be even at SNF or in any of our hospitals throughout the island. And the aspect of expanding testing criteria is not only applicable to the private and the public health facilities, but also the other prong approach that we have is active case finding. Where do we find these individuals that really they don't have any transportation, they don't have access to care because maybe they just don't have any insurance, or they have cultural barriers to care. So we look at these people that are very vulnerable and they live in these isolated remote areas, you know, with the fact that they don't present themselves to the clinics. And so we've been doing this, Sabrina and Chris, many years going out. It's called our extended outreach clinics, where instead of them coming to our doctors or our clinics, we go out and find them and reach out to them. And so this has been since the ARA grant, and we never stopped it because we felt it had a great impact. And so what we're doing as I speak is a pilot testing, and we're reaching out to these individuals. And again, we've canvassed yesterday. We're going to do again. When I say canvass, I'm not only saying that, I'm saying do a complete assessment of the individuals in the home. And of course, they're donning their PPE for protection as we journey through. And we just want to make certain that these pockets of infection, that if they are occurring because they don't come to the clinic or they don't go to the hospital, that we find these people so that we can completely try to eliminate the further transmission or the further community spread of the infection. And when we do find a positive case, we also would like to take it another notch, such that those that are living in the household, we can also test those household members and the close contacts and find out if, including those that are asymptomatic, to find out if they are also infected.
Mm-hmm. I wanted to ask about the Saginaw Lananza and Estumbo area. Was it selected because it's linked to other possible cases, or just because it's a vulnerable population and they don't have the means to or access to health care?
Right. We when we sat down, we assessed every avenue or opportunity. We are looking really at high-risk individuals, not necessarily because we've already reached out to those cases. We've done our household contact and our surveillance and our close contacts with those that have already been identified to be positive. As you know, Guerrero is a very densely populated village, and so we know that the ethnic distribution of that area is really diverse. So it's not just Chamorros. We also have FSM. We have Filipinos. We have practically every ethnic representation. And so what we want to do is we want to hit those areas that, as you mentioned, that are vulnerable, high risk, social determinants of health, that poverty could come into play, educational, they don't have all those criteria that we want to determine that they will be the best test at this point in time in terms of targeting them. Does that answer your question, Sabrina?
Sure. For the Saginaw Lananza area, what is the ethnic breakdown? Is it mostly Chamorros?
There are Chamorros there, and I believe there are FSM, and I believe that area is the Dollar Down area.
Yeah, Dollar Homes. Mm-hmm.
Yeah, Dollar Homes for their agricultural. Yeah, so specifically, I believe a lot of them are Chamorros. Majority are Chamorros because of the land trust, right?
Yeah,
then those houses are really close together.
Right.
Yes, exactly. Very close. I mean, I have the opportunity to visit them because we did a walkthrough yesterday with all our collaborating partners, federal, local, and private. And the setup will be, as you know, in the Estumbo Gym. As I was journeying through, I asked my staff, take me to the area of Target, and they took me all around, and I looked at their conditions, and I said, wow, these houses are really, really close by. And you're right. This is really a great population to have this pilot project. And again, the setup is where they will come into the Estumbo Gym. That's where it's going to be held from 9 to 12. We're getting the 2 other schools right adjacent to the Estumbo Gym, so we can really do great trafficking. Of course, the National Guard will assist us in that, and we also have the Guam Police and the Guam Fire Department, and we will have a physician there just in the event anyone that presents with illness that we can take care of them should an emergency arise. We also have...
Linda, can I just cut in real quick and add a comment here from our Facebook audience? Asymptomatic people don't show signs of illness. They won't have any of the symptoms, but they carry the virus and can spread it. Yes. These are the people that need to be found and told to stay home. It's not the people that are sick already. What are we doing to test these... because I'm assuming if you're asymptomatic, you don't have the symptoms, but you're not meeting any of the criteria for this pilot testing. So
if they're asymptomatic and they present today, we will tell them to go ahead and exit out. However, bear in mind that since we started, people have been going to the clinics, the private clinics and the community health centers. We also were able to test those that are also asymptomatic, but we don't do the testing here on Guam. We send them off island through DLS because we wanted to focus again on the high priority groups. So that's to say that we also have been testing them as we journey through. However, those test results went off island. And when we get them back, we include it in our data. So that's to answer your question. Now, yes, you're right. They are asymptomatic, and that's the reason why we want to capture those that have symptoms, because the incubation period of this virus is 2 days to 14 days. And if anyone in their household or living in that have close contacts with them, we'll eventually find them. And like I said earlier, they will obviously be, this is another step notch where we can also test them for asymptomatic symptoms once we find the COVID positive.
What did you make of, we had Dr. Shea on, and he was saying that if the public health staff are going out and going into these homes and doing these screenings and talking with people, why don't they just swab these people while they're there at the house?
Yes, that was already brought up with ours, and we're going to do that for those patients that, of course, are homebound. Let's say they're bedridden. We have already talked about that. Those that can't make it because of their conditions. Again, that's already in discussion, and we are going to plan. We are already at that point where we can also do that. So, that is correct.
But I think what he meant was, well, if you're going to do that for the homebound, why aren't you just doing it for everybody?
Because what we want to do is, again, every household, sometimes we have no privilege to go in. Sometimes they're not home when we come around. They may be at, elsewhere. Of course, some people do practice social distancing, some don't. This is just like what we encountered during the dengue outbreak. We went out. Those people that were not there for whatever reason will leave messages on their door. There are times where we can't find individuals, and that is the reason why we want to do this drive-through and walk-through, because the walk-through for those who have no transportation, the drive-through, if we miss them somehow when we go out, that's another opportunity.
Linda,
we want to not miss any opportunity for this study.
If you don't have a pass, you can't get tested Saturday?
Well, that's a very good question. That's like an unknown at this point in time, because we don't know if we're going to get all our 100 people, that even if we give them passes, they may come up or not. That always happens. Just like when you schedule an appointment, we say to the patient, please come for your medical appointment. Don't miss it, because, it's going to take time for you to get another appointment. We always have patients that have what we call appointment failures. At the community centers, it's at least 20% appointment failures. That's beyond our control. So let's say we have 50 people that already come and they have their passes, and yet okay, maybe there may be other cars that come in and they heard about it from their friends or through social media. And we're towards the end, and we feel that we will assess them. No doubt about it. We will assess them. And if we have that opportunity to go ahead and of course they present themselves with mild symptoms, we will take them till we reach our quota. Now, if we surpass it, we will give them an information, a flyer that has all the contact places to go to, whether it's northern, southern, central, especially these individuals are living in these remote areas. However, that's not to say they can't go right now. They can go today. They can go today. They can even go tomorrow, and they can even go to any of our clinics that are open, and they're open from Monday through Saturday from 8 o'clock to 6 o'clock p.m.
Linda, so if
followed up as
right, if we go to these clinics right now, we listen to what the public health director says. When I show up, am I going to get tested, or do I have to have the symptoms and meet the criteria that you're applying for the pilot program?
Yeah, we will expand the testing criteria for those that are patients testing with illnesses, mild illnesses, like I mentioned earlier.
Right. So it's the same criteria as for the pilot program. Okay. Okay. Because people are thinking, Linda, that they're just like, like take me for example. I'm walking, I'm talking, I'm here at work, la-di-da-di, we like to party.
Yeah.
But I want to go get tested. That I'm going to get turned away.
Well, I don't like to say you're going to get turned away. We don't like to turn anyone away, and because we're federally qualified health centers, we don't turn people away.
So what are we going to say, Linda? We're not going to say turn away.
No, we're going to say that we will contact you, and of course the nurse will make the assessment, Chris, and we'll assess if you're at risk. Okay, so. Again, it's going to be dependent upon who you're in contact with, who you know, possible cases you've been around. We'll do all that assessment, and have you traveled, and all that information will be definitely taken. So we at the health center, even if you have nothing to contribute to pay, we'll take you regardless of your ability to pay.
And it's free, right?
Yeah. No, you know what? That's the reason why we have these programs. If they qualify for a sliding fee discount and they meet their income eligibility based on family size and income, they can get different percentages of discounts. So 100% is you just pay like $10 and that's it. But if you can't pay up front the $10, we give you a payment plan. So it makes it convenient for you to, collect.
So can you just clarify that?
Yeah, Linda, because we had heard from different doctors on the Physicians Advisory Group that the testing was completely free, and that we were told to say that.
Free for the vulnerable populations.
Okay.
Yeah, you have to watch how you utilize your words, okay? Because when you say Medicaid, MIP, they're fully covered, okay? When you say uninsured, of course, we base it if they come to the health center, if they have they meet the 100% sliding fee discount. That means that they only pay a minimal fee. However, the federal government does allow us that if they cannot come up with a minimal fee, then we can ask them to, again, either have a paper that says, okay, I only owe you $10. How long would it take for me to collect $10, like that? Or they have no fee, no income at all. They'll fill in a form, or a self-declaration form, that they have no income. And so we base it upon their face of giving us that information. And again, if it is covered, yes. If it's covered and paid by the insurance, yes, it is covered and you don't pay out of pocket. Okay?
So for the people that are in Estumbo that you're giving out the passes to, they also have to pay?
No, this one will be covered by the government.
Okay. Yeah.
Okay.
So you mentioned earlier
a few more on the different areas. So we're hoping that we can get all of them passed out. So and again, like I said, we don't know the volume, how many will come, even if we distribute those, and we'll play it by ear at the time when we're there, so we can make certain that again. We're hoping at least 50 people show up, but we're happy if 100. Right. And if more show up, then again, we can also revert them and we're going to get their names, and then we will refer them to the community health centers, or in this particular case, the community health centers. Okay.
You know, we've heard a lot over the last couple of days about how we have built up our testing capacity, how we are able to test, or should be able to test about 258. At least that's the goal a day. And so, why is the test sample just at 100?
It's a sample size, okay. And again, we're also wanting to do this sample size because remember, when you test 100 people, and let's say all 100 test positive, there's that possibility that there are household members that could also be positive. So for one infection, you're looking at 2.6 of other people being infected. So right there, you already double, right? You already have over 200 plus. And again, that's also dependent upon that individual infecting other people, other household members, other contacts, close contacts, whether they're related to them or not. And so that is the reason why we're putting that size in.
Right, but Linda, you know, I think it was the governor had said in one of the press conferences that we're going to be testing 258 people a day starting this week, but it's already Friday, so where are we with that?
Yes, we're going to be doing that, and again, like just yesterday, late afternoon, we just received another 400 test kits. And so, but
we're still testing 40 people a day when the governor said that this week we were going to test 258 people a day, but it's already Friday.
You're just counting only the people that are seen at the test that is being done on this coming Saturday. But remember, we're also testing at clinics, whether they're public health clinics. We're also testing at the private clinics and also the hospital, and off-island testing through DLS. And so just to give you a picture, these are all the entities that we're doing, and we also have the National Guard also doing their testing as well. And so we're trying to put all our resources together so that we get all the available resources coming from DLS, coming from GRMC, coming from GMH, coming from our laboratory, and putting it all together so that it matches that amount.
So are you saying, Linda, that if we add up all those things, we are testing 258 people a day, or no?
We're starting, and we're going to continue. And again, it's all going to be dependent upon how many people show up. Right. So our goal is to try and test many more people as we can as we journey through.
Okay.
For Saturday, I wanted to get back into Saturday. Are you going to have the results ready that night, or how long is it going to take to get the results?
Yeah, that's a very good question. I'm assured that we have our PCR testing, the ABI 7500. We will base it upon how many show up, as I mentioned, because we have that capability of also sending it off island, and we also have that capability of running it at our clinic here. So we also want to put some reserves in the event that we do have over the weekend. As you know, that's a time when a lot of people come into the hospital emergency rooms. So it's going to be dependent how many we collect, and I can't tell you exactly how many will come. So it'll be contingent upon that. If we looked at 100, we have the capacity to test them here, and we also have the capacity to test them off island. Maybe we'll split it in half. Again, it would be also dependent upon the illness that we find, and again, our physician group will make that determination as far as which one will be prioritized in that group that we collect.
Okay, but I would think that if you guys set a sample size of 100, then you would know if you'd get the results the same day.
Yeah,
and figure it.
We could do that, not a problem. Again, I want to put some reserves because we don't know what's going to happen over the weekend. If a surge of patients are going to come in, the hospital has, although they have their testing now, sometimes we rerun tests if the physicians feel that it needs to be done through the ABI 7500. We will run the test, even though they did it there. We'll run it again if there's that feeling that the providers feel confident that sometimes they are ready to be discharged, so they're assuring that 2 negative results occur before they discharge them. So, these are things that are taken into consideration.
Yeah, and Linda, again, just I feel like we have come out this week and we said that we're casting a wider net. We're going to do this, we're going to test, but just not seeing the volume of tests that we were told we were going to see.
Again, this is a pilot test, and we are still testing as we speak.
Okay.
We will eventually get there, and again, if I get under positive cases, we will test in the homes.
Okay.
And again, if anybody is in the home front and contact, so we can double that up right away.
How many test kits do we have currently in our inventory?
Okay, in our inventory right now as we speak, we have a total, okay, I'm gonna gather that in a minute here. We have right now, as I mentioned, 400 arrived.